Hi, I'm Dr. Ann of Dr. Ann All In and You First Health and Rejuvenation here in sunny Southwest Florida and Fort Myers. First, I truly want to thank you for trusting not only myself, but my educated and compassionate staff and our facility to be your final option for your upcoming surgery, procedure, and really your overall plan for your optimal health, wellness, and feminine rejuvenation and empowerment plan. The following information is going to review some questions and information that's very valuable for your upcoming visit. So please listen closely, and if it brings up any questions you have, bring those with you for our visit as well. I'll look forward to seeing you soon, and know that I'm going to be all in with you for your optimal path and outcome. So first, we're going to go over some pre-op tidbits that my staff and I put together for you for your upcoming visit and procedure. No stress is key. Assure all of your questions have been answered and you have any prescriptions for after your procedure. Also, don't take any chances. What's that mean? Be mindful about being around sick family and friends. This is your special day. Let's not ruin it. And if you're feeling sick, please let us know ahead of time, as this can pose some risks related to anesthesia for your procedure. Next, remember, no smoking is my policy. Refrain from smoking for about 2 weeks before your procedure and 2 weeks after your procedure. This is your recovery. Don't take it lightly. We want optimal healing during this time. Lastly, stay healthy and hydrated. Be rested, eat healthy, and stay well hydrated for your upcoming day. And let us know, of course, if there's been any changes in your health that might be relevant to you having the best outcome possible. And very important, have nothing to eat or drink after midnight the day of your procedure. And if you forgot, make sure you let us know at check-in. Now let's talk about the day of the procedure, our special day. Nothing to eat or drink after midnight except a sip of water for any medically necessary prescriptions that we would have discussed at your pre-op visit. Dress comfortable, bra is optional. We recommend leggings or yoga pants, etc., and some secure panties, easy on and easy off shoes. Hair ties are helpful as well. No jewelry. This day is about you, not your accessories. Bring a few sanitary pads with you, just in case. Remember, no tampons are allowed. Bring your prescriptions with you in case you may have any questions about directions, frequency taken, or anything else you were unsure of. You must have a designated driver to get you home safely and to kind of tuck you in after your procedure. Tell your anesthesia provider of any concerns you have had with any prior surgery experiences. We don't know if you keep secrets. We will do our best to avoid these for your special procedure. Assure you agree with your ID band and/or allergy band. This is not the time for surprises. And lastly, breathe. You are exactly where you are supposed to be. So lastly, let's review some post-op pearls. First, Ice Ice Baby. Very important, the first 48 to 72 hours. This will reduce the pain, swelling, bruising, and possible hematomas that can form sometimes after this type of procedure in such a gentle, fragile area. Frozen veggie bags are the best. Just don't apply them directly to the skin. Bland diet the day of the procedure and gradually increase the diet as tolerated, and keep well hydrated. And of course, I always recommend whole food plant-based diet is the best. Take your prescriptions as prescribed, including the antibiotic and any pain medications. Also resume any other medications you were taking before the procedure. The anti-inflammatory will work best for discomfort. Only use the sedative or pain pill if you're having true pain or if you're going to sleep. Call our office if you feel you're having an allergic reaction to any of the prescribed medications or something just doesn't feel right. Move in and out of positions with caution. For example, laying down to sitting, sitting to standing, and getting in and out of a car. Use caution when twisting or torquing your upper and lower body. These suture lines and tissues are very fragile. Don't be afraid to call with concerns, such as bleeding more than expected, foul vaginal discharge, pain unrelieved by your meds, or pain not improving, or a temperature greater than about 100.4 degrees. Of course, outcomes may vary, but we are here for you, so don't be shy to call. Stay hydrated and eat healthy, especially the first few days and the remainder of your healing process. You did this for you. Don't sabotage it. No exercising other than light stretching your legs a few times a day until your first post-op visit, which is typically by about day 10 to 14, but we'll let you know that the day of your procedure. You'll be given parameters to gradually increase your activity level with that initial visit. There is no rush. Very important, no sex, alone or together, until after your final post-op, which is typically about 4 weeks after your procedure when we know the surgeries have dissolved and your healing has gone as planned. This visit is important, and behave on this one. No driving for at least 3 days or longer for any unforeseen outcomes or while taking the painkillers. Use recommended hygienic sprays or salves that we give you or discuss with you, and only use the pads for bleeding. Remember, no tampons or anything internal until I give you the okay. Thank you so much for choosing to pay attention to the information we just discussed. If you didn't, make sure you tune back in so that you can review it again, and it can bring up any questions that might come to mind for you to bring up during your visit, because we're here for you. And again, I want to go ahead and say I thank you for entrusting not only myself, but my educated and passionate staff, as we're all here for you to be all in to the best of our ability towards your path for optimal wellness and health and empowerment on this very important journey that we don't take lightly. And we're definitely all in for you, and we look forward to seeing you.